Hi, my name's Patrick Grover, and I'm a neurosurgeon working at the National Hospital for Neurology and Neurosurgery, and also at the Cleveland Clinic, both in London. And today I want to talk about meningiomas. Meningiomas is an area of neurosurgery that I particularly specialise in, and it describes a benign tumour of the brain. It's not actually a tumour that originates within the brain itself, but it originates from the covering of the brain and then can grow in towards the brain and cause symptoms that way. So it's important to stress that the vast majority of meningiomas are benign and manageable, and usually they're slow growing. So on average, they might grow 1 to 2 millimeters a year. They can grow all around the brain and they can affect lots of different parts of the brain or different nerves. So, for example, they can cause progressive weakness over time or maybe a speaking problem. If you have a meningioma, the first step is often to make a clinical assessment and then do an MRI scan and then wait and see. So, the treatment options in general are split into three categories. The first was surveillance. So certainly with smaller meningiomas, it's very reasonable, particularly if they're not causing symptoms, to initially monitor. And that would usually be with an initial MRI scan at 6 months, followed by further scans on a yearly basis. If meningiomas are growing more quickly or they present when they're very large and are causing neurological symptoms, then we talk about treatments. And the main treatment really is surgery. Certainly, if a meningioma is accessible, surgery is a very good treatment because for most of these, it will remove the tumor entirely and there will be no risk of recurrence and a very low chance of side effects. Some of the more deep-seated meningiomas can be harder to treat surgically, and sometimes it may be that a portion of the tumor is taken out and then the remaining tumor is monitored in the longer term. After you've had surgery, the meningioma tissue will be sent to the lab. This gives you a grade for the tumor, and that can be from grade 1 to 3. And the vast majority are grade 1, which means they're slow growing, and then the higher grades are slightly faster growing and might have a higher chance of coming back. After you've had surgery, or say you have a smaller, more slowly growing tumor, there may be a consideration of either radiosurgery or other forms of radiation delivery. And if this is the correct treatment for you, it's important that that's assessed at the beginning of your journey. So typically that will be after discussion with a neurosurgeon and also in collaboration with oncologists. And lots of these discussions will happen in multidisciplinary meetings. And the different radiation options are either radiosurgery, which is a procedure carried out as a day case, which can be very effective for small meningiomas, and it can prevent further growth in the vast majority. Or the second option is what we tend to term fractionated radiation treatments. So this is, rather than day case radiotherapy delivery, it's carried out over a course of 6 weeks with daily fractions of radiation delivered 5 days a week. And that can be for meningiomas that are more extensive or are not suitable for radiosurgery because of their size. So that's a quick summary really of the different treatments for meningiomas. I think the key points are that if you have been diagnosed with a meningioma, that you see a surgeon, that your case is discussed in an MDT, and that the best treatment for you is decided at the beginning. And often it's surveillance or surgery, and the outcomes for the vast majority of patients are very good.